Good night, everybody. This is Iris Garcia. I'm going to be your teacher. It's 8 o'clock, 8 p.m. As I was sending the message to the group, it's the moment to start the class. Now, well, we are 6 from 16, well, from 17. Is that okay if we expect a little bit? I mean, 2 or 3 minutes more? It's your choice. Okay, Paulo, it's okay. So let's wait 2 minutes more until 8 and 3, I think, because, well, you all had the message with enough time to get in contact, to read it, and to get into on the schedule that is proposed, okay? Okay, Laura, thank you. So let's wait. I'll be back in 2 minutes more. Okay, people, let me see. Can you watch my screen? That's okay if you turn on your microphones and then you send me an answer, okay? Okay, perfect, Luz Adriana, thank you. Okay, thank you, Diana, for your question. What time do we start the class? Let's start now. Let's stop this a minute. Okay, can you see me? Please turn your cameras on just a little bit in order to meet you for a second. Yeah, because it's not too much time into the theoretical class. So, hi, nice to meet you. Nice to see you in this workshop, the medical English course. Well, as I was telling you at the beginning, we all have the schedule and everybody has on WhatsApp group the Zoom link, so it's possible to get on time. Now I'm gonna close this and let's start with the presentation, okay? Please let me know, can you watch my screen? But please talk to me, it's not
Yes.
not possible, not
Yes,
easy
teacher.
to talk by my own just. Okay, thank you. Well, the Medical English Workshop is a course, a very short course, of medical English. It's focused on doctors, of course, and we have to get clear on this. So at this point, let's talk about it. Who I am, first of all, the principal objective of the workshop. How about the class, how it is organized? What about homework? And if you have a question, please let me know at the end of this presentation, okay? Who I am, first of all. Well, my name is Iris Roxana Garcia Jimenez. Yes, I'm Latina. I live in La Paz, Bolivia, of course. I studied at the Latin American School of Medicine in the Republic of Cuba long ago. Please don't ask how many times. I feel so old while I talk about it. And at this point, I'm a general practitioner focused on emergency medicine. I'm a member of the FEDALAT and the Bolivian Pain Association. Okay, so because of the supervisors, yeah, I got the experience to get into this workshop. It's the, I'm not sure the 5th or the 6th group I'm teaching. But with medical English, I have the experience while being at the university, because in Cuba, we had a specific class about this objective, okay? The principal objective of this workshop is, of course, a workshop. So we are going to practice English together in order to learn and improve medical vocabulary. I'm not evaluating medical knowledge or teaching medicine. Please, we have to be clear on this. We are not going to discuss clinical cases, or we are not going to have specific pathologies. This is a general view, a very fast view about medical English in just 2 months. Why I'm telling you just 2 months? Because it's enough time to get the basics. I mean, the most important vocabulary, but it's not enough to be ensured that, or to ensure that you are ready to be extra qualified about this topic specifically. At the university, I taught this class for 4 years, so you can notice the difference. 4 years in contrast with 2 months, it's different. So it's possible to make it, but we have to read a lot, we have to practice a lot, memorize a lot. During the presentations, we are going to have these special tips. This blue guy, this friendly one, is showing that something is important. The slide is important because of the vocabulary, because of the grammar expressions, or some details that you have to take in account, because we are going to consider this at the end of the module in order to be into the test. And this red guy is showing us the self-studying homework, the self-studying job you have to continue at home. Of course, self-studying is because you need to memorize a lot, I think. And with these guys, it's easier to catch the slides and not get into a mess, okay? How about the class? Well, as I was telling you, we have 2 levels, M1 and M2, Model 1 and Model 2. Both of them have the same organization. We have 2 theoretical classes, 2 theoretical sessions on Monday and Wednesday, 1 hour each day. It starts at 8 p.m. Today we got some extra minutes in order to expect some classmates, but from Monday, we are going to start at 8 p.m. No matter if I'm alone, I'm going to start at that time. Why? Because we have a schedule to follow on. In order that you can get late, of course, but I can notice what time you are getting into. So it's easy. You are going to lose the session if you are not on time. It's your choice. Moreover, we have 2 practical sessions. What I mean with practical sessions, we have the chance to talk together for 15 minutes in groups, okay? We are 3 people in each group on Tuesday and Thursday. So taking this in account, I'm gonna send you the role in the next slides, but we have an exception. At this point, we are 16 students. In order that, we have 4 groups of 3 people and 1 group with 4 people, okay? All of the activities are live streamed on YouTube, so you have the chance to check it later if you couldn't get all the contents or you need to refresh some details. Well, you have that extra point, okay? About the workshops, well, all the workshops have a score. Please try not to be absent. All the workshops, I'm going to consider who's attending or not, and according to that, we are going to get the promedium, and that's important if you pass or not to the next model. Sometimes we could have a personal situation, maybe trouble, something that is not expected. And maybe you prefer to change this schedule as a group, not by individual. By individual, it's not possible to me because of the organization of this workshop, okay? If as a group you get in contact, you get in touch and ask for changing the schedule, it could be great for me, okay? Please let me know by a message to my personal WhatsApp at the end of the class, I mean in the theoretical class, or 1 hour earlier to the workshop in order to organize the activities, okay? Again, all the activities start at 8 p.m., same as theoretical class, following the same link. It's not gonna change in the Model 1. Model 1 has its own link, Model 2 has its own link too. The groups that I organized following the list that I got from the academic supervisor is this. We have students from Bolivia, Honduras, Mexico, Nicaragua, and that's all. You have this list. I'm gonna send it to the WhatsApp group for checking in which group you are. And then please get in touch by the WhatsApp group, organize yourselves. And this is group 1, group 2, group 3, group 4, and group 5. If the schedule that I'm gonna send you to the, well, it starts at 8, I mean, 8:15, 8:30, 8:45, and 9 p.m. If the schedule is not able for you because of job, because something, well, an extra situation, as I was telling you, please let me know and we are going to correct it. Tonight, I need to know about these groups. I can organize groups for each one in WhatsApp if you want, and then we decide. If one of you, I don't know, want to change from one group to another, well, try to exchange between colleagues, I mean, between classmates, okay? As I was telling you, group number 1 has 1, 2, 3, 4 students. Because of this situation, we are 16, and the rest is for 3 people, okay? About homework, well, we have assignments, we have quizzes, and we have the final test. Assignments and quizzes, all of them are the 30% into the score. I mean, you send me your homework every weekend, and according to that, I take a score and then I publish it with the institute. In the final test, we have 1 hour to develop it. It's the same organization. You have this chance, okay? Everything has to be handwritten. Nothing typing, please. I need it. I need to be in that way to ensure that you're doing by your own. As I was telling you, the attendance in the theoretical class and the workshop is for a score. And all the activities have a diary pool. Following the diary pool, well, it's the easiest score to get with, okay? So, are the classes going to be recorded for us to watch later? Yes, in YouTube. The link stands on YouTube, and then it's possible to watch it again. So it's possible for you to make it. Okay. Please, every homework has guidelines, and I send them every file again in order to ensure that you are reading this. Please take this in count. You can print the file if you prefer to do it, or just send me the answers by WhatsApp to my personal WhatsApp, not the group. Okay? All the answers, as I was telling you, must be handwritten. If I cannot read or understand the answers because of the handwriting, it's not valid. Please be clear on this. Try, make an extra effort. It's going to be easier for us. Please send me a PDF file, organized all pages according to the order of the questions. Everything in vertical position, please. If I cannot rotate the file, I don't have that capability. I'm not very well with doing these activities in the computer, but it's your responsibility to send me a file that I can read, okay? All clear pages. If I can't read or see them, they are invalid. I'm not going to take them in count, please. Usually deadline is on Tuesday midnight, but according to the date I send the file or how many questions I send you, the deadline could change. Of course, you're going to receive the same as here, the day and the hour of the deadline. Well, after receiving the key answer, no more files are allowed. I mean, we got the deadline, I sent the key answer to the group, and then time's up and no more files. I'm gonna check again, okay? Any question? Well, we were having some during the speech, yeah. At this point, anybody has a question, maybe a detail to check? No
Are
question?
the classes are going to be recorded?
Yes, on the live stream on YouTube, they stay until the end of the course, and you can check them all at the time you need it. In order they are live stream, they are getting recorded, and I think 15 minutes while after finishing the class, you can watch it. Okay?
Okay, thank you.
Okay, perfect. So give me a second. I'm gonna share the next screen. Any other question, maybe? Any other detail you want to check, maybe to punctualize? Well, I don't think so, right? Okay, let me see. Can you watch my screen?
Yes.
Great. Yes. Black and colored one, right? When talking about medical English, we have to take it in account. This grammar part is very important because this is the basis of understanding what we are going to talk about and how we can sometimes construct the medical term. That's why we have 4 types of a word. I mean word parts, okay? We have the word root, the combining form, the suffix, and the prefix. Okay, the word root contains the basic meaning of the term. Usually it's in Latin, usually it's the same in English and Spanish. That's why it's easy to catch what we are talking about. For example, gaster, to stomach, of course. The combining form is the word root, and we add a vowel at the end usually. For example, gastro. We know that we are talking about something in the stomach, okay? Suffix the same as in Spanish, usually but not always indicates the procedure, condition, disorder, or disease. Of course, it goes at the end of the word root and combining form. And the prefix, usually but not always, indicates location, time, number, or status. Okay, let's go ahead. Going into the word part as a guidelines, we have to understand this. A word root cannot stand alone. It always needs a combining vowel. Always need a suffix, always need a prefix in order to get in sense and then make possible to talk about it. A suffix must be always added at the end of the word to complete the term, of course, the same as in Spanish. The rules for creating a combining form by adding vowel apply when a suffix beginning with a consonant is added to the word root. We are going to check some examples. And when the prefix is added, it's always placed at the beginning of the word, always, of course. Some examples for word roots and combining forms indicating color in this case. The word root, cyan, we use the combining form, the O, and we get cyano. It means blue, of course, cyanosis. We have eryth, that means red, with erythro, in order to consider the erythrocyte, site as a suffix, of course. The leuco, we're getting into white, leukocyte, again with the suffix, okay? Melan, talking about black, melano, let's think about melanosis. Poly or polio, that means gray, for poliomyelitis. So let's consider this. Easy to do, is the same as in Spanish. That's why it's not as hard as it looks. Some examples about suffixes. We have all of this mess. For example, suffixes as noun endings, we have this combining with these situations to combine. Suffixes meaning abnormal conditions, we have all of these ones. Go easy, aya, for example, with, I'm going to correct it previously in you. The stomach, gastrosis, plus osis, of course, and suffixes meaning pertaining to. Let's consider just as a grammar key in order to check. About suffixes related to pathology, we got all of these examples. Algia, dynia, iris, megaly, malacia, necrosis, sclerosis, stenosis. Of course, the meaning is the same as in Spanish. I'm making the combining. We have all of these medical terms. For example, for megaly, the enlargement, hepatomegaly, right? For necrosis, tissue death of the tissue, arterionecrosis. So we got this. About suffixes related to procedures, we have synthesis, graphy, gram, plastiscopy. For example, gram, picture or record, angiogram, right? Same as in Spanish. Scopy, the visual examination, arthroscopy. Possible to make it, right? The last one, okay, Elena, at the end we are going to check it again, please. The double R suffixes is a grammar rule. When you have this word, the Raj and Raja, always use double R when you know that the suffix is present. For example, hemorrhage, hemorrhagia. Let's consider this. Ria, for example, diarrhea, not with an R, also double R, okay? Let's take this in count, because while writing down, if you don't write down properly, of course, well, you can be the point of some jokes. I tell you by experience, it's not nice. Talking about prefixes, as we were talking about this some minutes ago, it's added at the beginning of the word to influence the meaning of the term. For example, prenatal, perinatal, postnatal. And you can check, you can prepare the term the same as in Spanish in order to organize the idea, and then you can infer the meaning sometimes. Some prefixes that are describing direction, quantity, size, and amount. Just some examples. You have ab, for example, away from, negative, absent, add, toward, into, to direction. Dextro or sinistro, right and left. Ex or in, macro or micro, megal, ology, right, pre or post. We all know it is the same as in Spanish, but for making a review, it's nice. About contrasting prefixes, of course, prefixes that are opposite in the meaning. For example, ab, that means away from, for abnormal. In contrast to ad, that means toward or in the direction of, addiction, for example. Dis or eu, dysfunctional or eupnia, for example. We have hyper and hypo, inter, intra, sub and super or supra. As you can see, the same, right? A grammar tip, in my opinion, a very important one, is this chart. In this chart, you have some vowels. Well, the rule is showing you this detail. When the singular term ends in the suffix a, the plural is usually formatted changing the e into the ae. For example, vertebra is in singular, vertebra is in plural. Pronunciation is the same. The difference is while writing down. Maybe while reading, we consider that it is in Latin, maybe, or maybe with a mistake, but no, it's singular or plural. It's a very important detail. There are some examples to catch the idea of this. Another one, for example, this. If the singular term ends in the suffix nx, the plural is usually formed by the x ending to the g's. For example, we have one phalanx and we have two phalanges. We have one meninx, we have three meninges, right? Another one. If the singular term ends in the suffix us, the plural is usually formed by changing to the ending to I. Alveolus, one alveolus, one malleolus, in contrast to alveoli, a group of alveoli, two malleoli. Okay, let's consider this in order to write down properly and to understand the correct meaning while reading maybe an article or during the class, okay? Just a detail is for you. Please study all of this because it's an extra point. The grammar tips that we are talking is extra information, but it's the basis to understand everything. Let's go to the contents of today. Until this point, is there any question, any detail you would like to consider to talk now? Elena, we can come back at this point and you show me the slide you need. Elena, are you there? Well, any question maybe about the grammar tips, grammar details in order to consider?
I have a question, but about do we have a textbook or something to study or read about?
Well, actually, all the material is prepared by my own. And I usually send the slides just to the ones that are in class, not the ones that are absent. Okay? So it's possible to study from that material in order for not losing the details and having a basis to study or to prepare the test, okay? At the end, we fill the diary pool. I know who's present and who's not. And I send the file to the ones that were there, okay? Let's go ahead. Okay, let's go ahead. The contents of yeah, going into the medical English are this. We're going to take in account health and illness, parts of the body, 1 and 2. We are going to see these details about 1 and 2 when we arrive there, and body functions, a general view of body functions, okay? When we talk about health and illness, we, as doctors, as healthcare providers, we need to know how to make proper questions. Some examples are this in this slide. For example, what brings you in today? Or maybe what hurts? Or maybe how do you feel today? When do you feel the worst? Does it hurt all the time? Okay. This slide is showing you that for one question, you have more options. You have many ways to make the same questions to get into the point with the patient and start the communication. So I'm not closed if you have different questions that go to the same objective, of course, and you have the chance to talk about it. You have the chance to create new questions maybe, and according to that, it's possible to make it better, I mean. As I was telling you, I'm gonna send the slides. So check this, read this, and according to that, it's gonna be easier to do it. Let's come back. Going to the next. More questions. For example, do you smoke? Or maybe do you take any recreational drug, like marijuana, for example? Do you drink alcohol and how often? Well, questions that we really need to know. Are you sexually active? Have you had any previous surgeries? Do you take any medicines or supplements? Well, details we need to know, just examples, but you have the way to ask for this, and it's better while we listen or we write down more and different questions going to the same objective, okay? We have to consider these details. While talking to natives or people who's in English, you have the chance to understand if they feel healthy or unhealthy, considering these synonyms, we can say. If you are in good health, you are well and have no illness, you have no disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. It means if a patient tells you, I feel healthy, I'm fit and well, I'm well or very well, I'm in good health, all of them have the same meaning. There is no illness, no disease. But the patient can also tell you that feel unhealthy, unfit, unwell, not well or not very well, poorly or in poor health. For example, how do you feel today? Poorly. I mean, I feel ill, I have something, okay? It's very important to catch the probable ways that patients can give you the answer. That's why when we have to consider this situation, we must understand these definitions: illness, disease, and sickness. In Spanish, it's very easy because you say, I'm healthy or I'm not healthy, and that's enough. But in English, it's different. In American English, particularly, you have the sickness, the illness, and the disease. This difference is going to show you the context that the patient is living on and how, while being medical providers, you have the chance to understand how the process is going on. For example, when the patient says that has a sickness, I feel sick, they could have some symptoms or they could feel not so good at the moment, but there's something that doesn't really need to go to the doctor, doesn't really need a treatment, maybe with a diet, with some rest, it can be solved. For example, a flu, you don't go at this point for a common flu to the doctor. You just stay at home, take a tea, maybe paracetamol, and that's enough. That's a sickness, something that the patient can control by his own. On the other hand, we have the illness. The illness is the presence of a specific situation, not disease, a specific situation. And of course, the patient feels the needs to go to the doctor in order to get an answer, a response, why the situation was going on. For example, if you get with diarrhea and vomiting, the patient gets with diarrhea and vomiting, it's not going to stay at home just. They usually go to the emergency room, look for some help, look for a doctor. And while the doctor evaluates the situation, makes the physical exam, maybe some labs, and then gets with the diagnosis of gastroenteritis. Well, the doctor decides that you start treatment, some fluids, and then you can go back home. While finishing your treatment, you get recovered, you get healthy again, there's no trouble, and you can continue with your life without any consequence. That's an illness, a situation that can be solved with a treatment in a period of time that usually is not too long. Okay? In contrast, we have the disease. The disease is something that is wrong in your body function. I mean, your body is not working properly. It has psychological and physiological dysfunction. I mean, for example, when you have leukemia, for example. Leukemia is a disease because, according to the type, to the process, it has a long treatment, not always has a cure. You need the opinion of an expert, from the specialist. And according to that, you get your diagnosis and you say that it's a disease because of these changes in the function of your body and changes in your environment. You need a specific diet, a specific treatment, lots of taking care of a lot of situations, and it's very difficult to try. A disease because of the long treatment, sometimes, as I was telling you, has no cure. Well, and it's a situation. Another example about a disease could be a diabetes. It has no cure. You live always with treatment. You need the opinion from an endocrinologist or a practitioner or a physician to get the diagnosis. And if you leave the treatment, of course, the situation is going wrong. That's the difference. With an illness, a general practitioner can give you the diagnosis with the support of labs and, studies, lots of studies, right? But with a disease, you need lots of situation and the opinion of an expert and a specialist, okay? When we talk about sickness, it's the same of illness. Well, they are similar, but not the same. Almost the same. Some patients refer to sickness as a symptoms, not as a specific situation. That's why I feel sick. Could be a flu, could be headache, could be nausea and vomiting like this is an example. It's very general, something that comes and goes and doesn't need a treatment, okay? But following the history in medicine, sickness is also used in the names of few specific diseases. For example, travel sickness or sleeping sickness. At this point, sleeping sickness are sleeping disorders. It's different, right? Well, considering this difference between illness, between sickness, disease, and illness, you always have the possibility that patient can tell you in this way. When you ask, how do you feel? They could tell you, I was sick this morning, and the possible meanings, I was ill this morning, I felt unwell this morning, I vomited this morning. It's according to the context. You can catch the meaning. If the patient said, I feel sick, they can say, I feel ill, I feel unwell, I'm nauseous, I feel the need to vomit, but it's at this moment. So according to the context, as I'm telling you, you can understand the meaning of this. So we have to be open-minded with all the probable meanings, okay? Going into specific words, for example, recovery is when a patient returns to the normal health after illness. He had recovered. If the patient's health is in the process of returning to normal, the patient is improving. I mean, if the patient has a gastroenteritis, lots of diarrhea, lots of pain, starts the treatment, and in the process there is no pain, there's no diarrhea, but still has some pills to take, some antibiotics to take, the patient is improving. But if the treatment is not correct and the patient starts going wrong, more vomiting, more diarrhea, medication is not correct, well, the patient is deteriorating. Okay. We can also say, as a common expression, the patient made a good recovery, full recovery, or complete recovery, according to the situation of this. Okay, what's going on? In speech, while talking, we often use the verb get to talk about change. I mean, we can say get over an illness, we recover an illness, get better, we improve, or get worse, we deteriorate. If you tell me get over, get better, or get worse, it's the same to recover, improve, and deteriorate. Take it in mind. But the proper way to talk about is with these expressions, okay? For example, if the patient has a disease, okay, everything is going nice without any complication. If the patient is better, but then gets worse again, maybe because has an extra infection or a sickness, or maybe has avoided the treatment, well, the patient has relapsed, okay? And in another way of situation, in recurrent conditions such as cancer, the word of improvement is remission, okay? Cancer gets into remission, not gets in cure, gets into remission, gets asleep again. For example, he got over the illness very quickly, following this example. Or 2 years later, she remains in complete remission. 2 years later, in treatment, she remains in complete remission. So that's nice, right? The illness wellness continuum is the process that sometimes we don't check while studying medicine in Spanish, but we check in English. You have this score, your comfort zone, the premature death, I mean, when you get a disease or an illness, and you get, well, something when you are fit, when you are well. And following this score, the patient can choose how feel at the moment following these definitions. And then it's easier to understand how the process of health is going on. It's always for staying in movement. Not everybody can stay in the high level of wellness. It's not common to stay there, but it's a possibility, right? Please read this slide as an extra information for catching vocabulary, for catching the expressions, and that's an extra slide. Okay, until this point, any question maybe? Nothing? Okay. There are no questions. Okay, let's go ahead. Talking about parts of the body, I divided this into two places, we can say it. The external parts and the internal parts. Let's talk about the external parts first. Okay, here's our red guy. Self-studying, please. This male, this guy, in my opinion, is one of the most complete pictures, because you have here a particular situation. you have something in blackened words, something into parentheses, and a free word. In Latin is in blackened words, okay? Latin is the maternal language of medicine. We all know about it through the history. But in English, we love the mess to talk in medical term, in Latin, or in the common term. That's why we must study the three ways of talk about it. For example, oris is in Latin, mouth is the common term, and in parentheses, the medical term, oral, right? Another example, oris is in Latin, ear, the common term, and otic, the medical term. Everything has the same situation. For example, pubis is in Latin, there is no common term, and pubic is the medical term. Another example, femur is in Latin, thigh is the common term, and femoral is the medical term. Please check all of this, consider the situation, practice on this, and according to that, we're going to talk tomorrow during the first workshop, okay? When we go to this second chart, the female structures, I found it as one of the most complete with the common terms, okay? The social ones, in order to get in touch with these details. But remember, these names are here again in Latin, in medical and common term. Make a contrast on both of them. They're going to be the same, just for sending a complete picture. While talking about parts of the body, referring to the parts of the body, well, as a general information, we know that limbs are upper and lower, okay? The arms and the legs. The trunk excludes head and limbs, of course. Patients usually say as a common expression, I'm having trouble with my shoulder, hip, or knee. They are using the common names. Or they can say, I have trouble with my arm. While writing down, we have to say upper limb, right? Doctors often ask about parts of the body. Do you get any pain in the chest or in the stomach, in the back? Using common terms for making it easier to get in touch. Okay, consider this in the way to ask for, okay? About describing radiation of pain, well, of course, as doctors, we know that pain has a specific way to go through the body, and according to that, it's easier for us to catch the diagnosis, right? So as an example, it starts in the back, then seems to go into the right buttock and down the back of the right thigh to the knee, okay? This example, what is showing us? It's showing us the radiation, how the pain is going through the body. It's talking about hernia, lumbar hernia, if my memory is not wrong, but you catch the pain. Easy to find what is going on with this description. While talking to the patient, doctors can talk about some parts of the digestive symptom, for example. We can say bowel or intestine. Both of them are correct. It's not a trouble because both expressions, both words are common for patients. That's why we can talk about it. Okay, but while speaking to patients, it's better to refer about the anus and the rectum as the back passage. Why back passage? Because this expression doesn't sound offensive to patients because of cultural reason, racial reasons, I don't know. Usually Black people has the trouble on this and prefer to use back passage instead of saying anus or rectum. Okay, So let's consider this just an extra information, these details. Okay. Parts of the body too, the inner organs. We must remember this. We have the dorsal and ventral body cavities. Okay. The dorsal body cavities and the ventral cavities. Yeah, okay, an anatomical review. The ventral cavity. We have the thoracic cavity. As you can see, lots of parts. When you go into a book in English, you have the chance to find some terms in Latin mixed to English. So that's why it's important to check all of this information, okay? We have some details, lots of anatomical details. For showing you this, please read all of them. It's for home. That's why at the beginning of inner organs is the red guy, okay? Check all of this. If we read all of the slides, we don't have time. It's not enough to read all of this. About the mediastinum, again, anatomical review, anterior, middle, and posterior. Again, the anatomical review and landmarks to check the division of this. Another anatomical review, I love pictures, I'm sorry. And then the arteries, lots of vasa to check, okay? You know, A for artery, V for vein. Just check this. In the abdomen, we have lots of anatomical details to check. There's the arterial trunk, so let's check. Let's practice. A general view of the organs, the inner organs in the abdomen. The pelvic cavity, the pelvis and perineum in females. Anatomical details, okay. Then you have more in male, okay. And the dorsal cavity, so small. The brain and the spinal cord. Okay. Please, all the body parts that we are checking in this first presentation is just a general view. Through the module 1, we are going to see system by system and then get enough time to check the anatomical details, okay? So don't worry about it at this point. About body functions, for example, we have this about eating. We have some specific vocabulary in capital letters, and you have the opportunity to describe a process. For example, you are hungry, you are in a restaurant, and the waiter brings you your food. You smell it. It stimulates your appetite. You want to eat. Your mouth waters, filling with saliva. You take a bite of the food. It tastes good, and you chew it and swallow it. You eat more, but then suddenly you taste something unpleasant. You feel nauseous. You rush to the toilet and get there just in time to vomiting all the food you've eaten. Something has disagreed with you. Okay, you can watch this process. And then specific vocabulary, just an exercise for practicing, okay? About the 5 senses, a general view of this, just the functions. For example, 5 senses give the body information through, for example, sight by using the eyes, hearing by using the ears, touch by using hands, feet, and skin, smell by using the nose, taste by using mouth and tongue. Okay. Easy to make, of course, we all have this basic idea. Some other functions, considering a specific vocabulary. For example, speaking as a function, as a verb speak, as a noun speech. Function walking, verb walk, as a noun gait or step. breathing or respiration as a verb, inhale or exhale. As a noun, breath. Urination or micturition as a verb, urinate or micturate, or pass urine or pass water. As a noun, urine. Defecation as a function, the verb defecate or pass feces, pass stools. As a noun, feces or stools. The function menstruation as a verb, menstruate or have a period. As a noun, menstrual or monthly or just periods. Okay. And let's practice. I know it's a lot of information. It's a lot of, well, it's a lot of material to check and to read, but that's the objective, okay? Any question until this point? Nothing? Okay. If there are no questions, let me send you the pool to take attendance, please.
Sorry. Well,
Yes.
You have shown us a lot of information.
Yeah.
And how can we learn that? Are you going to send us the material, please?
Yes, as I was telling you some minutes ago, I send the slides just for the people who's into the class.
Yes, tell us, give us time to learn a lot of words, please, okay?
Yes, it's an extra help, we can say, because the Institute has not a specific book. So all the slides, all the material I prepare is by my own. It has copyright, please. Yeah, don't share the material.
Okay, but it's necessary to review because there are a lot of words.
Yes, I know. And actually,
please.
this presentation is not too long. It's a meeting.
Okay, but anyway, okay.
Yes, next presentations are longer because of the material we have to take in count and all the systems, all the expressions, all the details we have to consider. This is a general view of the course. Well, I mean, with the grammar tips and the first parts of the body, the external parts, of course. As a general view, we have the chance to catch information to introduce to the next systems, okay? So don't worry, I'm going to send it to everybody.
Okay, thank you.
Give me a second to send the pool. It's attendance, please. According to this, I know who's here and who's not and who's gonna receive the slides. We are 16, so I need 15 answers. Okay, can you watch the pool?
Yeah.
Okay, perfect. So let's go ahead. During this time, if there's a question, I can understand. I can answer you. Okay, I have 13. I need 2 people more. Okay. 13 from 15. I need 2 people more, please, to finish this. Okay. I'm gonna paste in the Zoom chat the slides. Okay, it's uploading. It's a PDF file. Please let me know when you download it and try to open it now. All of you can check the file, the PDF Medical English V1. Yeah. All of you can watch it. Please let me
Yes.
know. Great.
Yes.
As you download it, please send me to the chat, yes, or got it, something to notice that you got the file, okay? Thank you, Pablo. Thank you, Laura. Great, Rodrigo. Perfect. Please, I need to know that everybody that is here got it, because I'm not gonna send it to the personal WhatsApp. It's just for the people that it's in the class. Thank you, Juan Octavio, Rinaldi, thank you. Dorian, thank you. Mariel, Laura, great. Luz Adriana, thank you. Andrea, thank you. The rest of the people can download it, can open the file. Is that possible for you to get it? Jimena, maybe Jimena is there. Diana, Elena, thank you. Ariel,
Yes, I did. I think that I was the first one and say that I have it.
and that you got it.
That, yeah, that I got it.
Actually, I don't have your answer. Please write it down again. Type it. Got it, or thank you, or yes, something like that, please. Mariel, Jimena. Oh, Jimena in two chats, okay. Please, when you get into the Zoom session, just use one device, because it gets as a confusion with the system and it's not correct, the attendance, okay? Alejandra, are you there? Who knows? Okay, 9:04, 1 minute more, and that's the full hour. Yes, we got it. Yeah. Any question at this point? Perfecto, Alejandra, thank you. Any question, a detail to talk about maybe? At this moment, well, you are allowed to be without camera, but at any class I can ask for to turn it on in order to take attendance, okay? Today there's no problem, but at any moment I'm gonna ask for this. Okay. The ones who got the file, thank you. The ones who got the file can leave the class. That's all. The schedule and the role of the groups, I'm gonna send to the WhatsApp group while finishing. And then if there's a trouble or you want to exchange, please let me know tonight, okay? Thank you. So you are free, yeah. Thanks for your attendance. Thanks for starting this workshop. So let's meet tomorrow at 8 p.m., okay?
See you.
See you, have a great night.
Thank you. See you.
See you, bye-bye. Okay.
Oh, thank you. Bye.
Bye, Elena, bye-bye. Well, Jimena, we are finishing. I'm gonna close everything. Bye-bye. I don't know if you got the material. Well, anyway. Oh, yeah. No worry. When the patient he had as a noun urine.